things like meningitis. So when we think of meningitis, that's just an infection in the meninges, which is the protective layer around the brain and the spinal cord. And when those get inflamed because of an infection, they become extremely sensitive. And that irritation, because of the sensitivity, is what drives a lot of these symptoms that we see in these patients. What exactly is that going to look like? Well, patients will usually present with headache, fever, and neck stiffness. Those are going to be the three triad of meningitis, right? They might tell you that their head hurts to move, or that they notice that they're avoiding any movement in the neck, right? They're trying to stay nice and stiff as possible. Light sensitivity is going to be another common one in meningitis, and then associated nausea and vomiting. Overall, they're going to look pretty miserable in these patients, especially when we talk about the neck pain. Neck stiffness isn't just like oh, I'm old and I slept on my neck wrong. When we talk about neck stiffness and meningitis, these patients aren't going to be able to flex their neck hardly at all. It's almost like their entire spine has been fused, right? They're not going to move that neck. So neck stiffness, neck rigidity is probably a better way to actually define that, or to call it as far as what we're looking for. But neck rigidity, fever, and altered mental status with that headache. Then that's going to be in contrast to encephalitis. Encephalitis is, again, another infection of the brain, but this is the brain tissue itself, not just the lining around it. So instead of the irritation that we see as the main feature, we're going to start dealing with direct brain dysfunction usually. And that's almost always because of the swelling that's been putting pressure on our brain. These patients will present with altered mental status, especially confusion and disorientation, not making much sense when they talk, almost like they're inebriated. And they're going to have a lot of problems following commands, right? So it might really present more like a stroke in this situation. But again, something that we can really look for to help differentiate that is going to be personality changes. Either the patient themselves might be able to tell you, I just don't feel right, or their family or bystanders around, their friends, they might be able to tell you that, this came out of nowhere and it's not normally how this person would react. And then we need to be concerned about seizures. Seizures are going to be a big clue for encephalitis. We shouldn't see any seizure-like activity with anything other than these late-stage severe type of infections. So a simple way to keep it in your head is that meningitis causes pain and irritation, and encephalitis causes brain dysfunction.